You're live.
Fantastic. Well, welcome everybody. Good morning to the all-party group on coronavirus's evidence session on vaccine passports. We're really grateful for all the parliamentarians joining us, but especially grateful, of course, to our panelists. We will have two sessions. In the first session, we'll be looking at the epidemiology, public health aspect of this. And in the second session, we'll be looking more at its effect on industry. Each will last roughly 45 minutes. So I will start by first introducing our esteemed panelists. First, we have Professor Stephen Riker, member of SAGE Subcommittee advising on behavioral science, professor of psychology at the University of St Andrews, and a member of Independent SAGE. Welcome back, Stephen. It's great to have you with us. Thank you. We've also got Professor John Drury, social psychologist specialising in the study of collective behaviour at the University of Sussex. Welcome, John. Thank you for joining us. And also Dr. Tallulah Oni, public health physician scientist and urban epidemiologist, a clinical senior research fellow at the unit's Global Public Health Research Programme, and also a member of Independent SAGE. So thank you all three for joining us. And I'll start by asking a question of all of you. As always, please don't repeat, if possible, what others have said if you agree with them. Definitely tell us if you disagree with someone in what they've said. But the first one, relatively broad, what is your understanding of a vaccine passport, both internationally and domestically? And should we be even considering this? Perhaps I could start with Stephen. I'm afraid to say you're on mute, Stephen, sorry.
You'd have thought I'd have learned by now. You can be a professor and not know how to turn on your microphone. So, I mean, the first thing is, in many ways, I think part of the problem we have is that we've conflated all sorts of very different things, leading to a very confusing debate indeed. So sometimes people refer to vaccine passports, which are contingent upon having perhaps one, perhaps two jabs. Sometimes people are talking about tests, which can be lateral flow or PCR. Sometimes people are talking about evidence of antibodies that you've had an infection in the past. So that dimension is very different. And the other dimension on which things vary is what these so-called passports will be used for. Will they be used for international travel? Will they be a matter of restricting what you might call exceptional activities like going to a football game? Will they be used to restrict everyday activities like going to a bar, going to a restaurant? Will they be used indeed to restrict essential activities like going to a supermarket or going to your job? And these have very different implications and are understood in very different ways by people. So I think what we need to be precise in what we're talking about and in what's being proposed. Because I think one of the critical issues, I mean, for me, one of the most critical issues is, how are they understood by people? Are they understood as a measure which is there to help them, to open things up, to look after their health? Or are they seen as something which in effect imposes particular things upon them, in particular the vaccine, and they become compulsory? Because once things are seen as compulsion, then they're seen as something that is done to you rather than for you and can generate resistance. And that takes me to my second point. In many ways, if everybody was vaccinated, we wouldn't need a vaccine passport. We could presuppose that you're vaccinated. And so in many ways, a vaccine passport, and here I am specifically talking about vaccines, are a response to failure. They're acknowledging we're not getting enough people vaccinated. And if on top of that, the sense of compulsion puts people off, and not only historically, but there's contemporary evidence as well, suggesting that particularly for people who have doubts and who are hesitant, the sense that this is compulsory can actually lead people to become more alienated. Then they become a real problem. And for me, I think the key issue, I think most of us would accept, that to reopen our society, the critical issue is to up the rate of vaccination. And that depends upon community engagement. If a particular intervention, a particular form of vaccine passport creates alienation and undermines the level of vaccine take-up, then it's counterproductive. Then that limits our ability to make people safe and limits our ability to reopen our society at every level.
So what, just to follow up on that, and I'll come to the other panelists. So what kind of vaccine passport would not elicit that negative response that you're talking about?
Well, on the whole, when you look at the evidence, and in fact, I was talking to some colleagues who've just completed a very large poll of 17,000 people, are working on the analysis even as we speak, so preliminary results. But they merge with results people get elsewhere. So things like traveling internationally is, on the whole, seen as something which is not a necessity. I mean, it is for some people, by and large, it isn't. And therefore, people accept that it might not be unreasonable to have vaccine passports. And we're used to it, of course, because to go to some countries, you require a vaccine passport. It gets more controversial when you go into the realm of things like, you know, going to a football game, going to an event, going to the pub, going to a restaurant. In particular, if you look at going to the pub or going to a restaurant, the figures suggest that it varies between different groups. So groups which have more of a history, if you like, of a troubled relationship with government and the state are more suspicious. So younger age groups see vaccine passports to go to the pub, to go to a restaurant, to go to non-essential shops, as they see them as more of an attack on liberties. Black people see them as more of an attack on liberties, 47% do, compared to 33% of white people. Younger people see vaccines as, in effect, compulsory when you make them necessary to go to the pub and to restaurants and so on. And again, so do Black people. So 59% of Black people see them as, in effect, compulsory if they're necessary to go to the pub and go to restaurants, whereas amongst the white population, it's 37%. So the danger is that we are alienating precisely those groups where vaccine take-up isn't as high and where we should be doing more to engage with them. There is also, incidentally, a difference between countries. So many people use international comparisons, and people may raise, for instance, the Danish Corona Pass, which is talked about quite a lot. But one critical factor there is Denmark is a high trust society. Some 75% of people trust others and trust the state and don't question vaccines, see them as done for us, don't see them as an act of compulsion imposed upon you. Sadly, in this country, levels of social trust have fallen to about 30–35%, and so there is more suspicion. And that's why it is so dangerous to do things which play into those suspicions, lead people to see vaccines as something that is an act of compulsion imposed upon them, and therefore alienate them precisely when we need to be getting such people on side and getting them to get vaccinated.
Thank you very much, Stephen. That's really helpful. John, what's your opinion?
So thanks. I mean, first of all, I agree with what Steve has said, but my comments to this question and the other questions today are based on three sorts of evidence. And the first is a rapid review of studies we carried out at the end of last year. So going back over the last year or so, all the studies that have looked at public responses to possible public behavioural responses to passports of various sorts. Over 30 studies were included in our review. Secondly, there's the evidence from existing schemes. So Steve's mentioned Denmark, and the other one, which is most well documented, is Israel. And the third source is what we know from what's already happening in the UK with testing and vaccination, which informs possible passports. So 3 points in response to the question. So these schemes are intended, and if they work, will enable more safe access to more activities to more people. But by definition, they exclude people, and it's likely that some groups will be excluded more than other groups. And as Steve said, there's lots of evidence that the public do support them for some areas of activity. International travel, live events, I'm not so sure, we can come on to that, but certainly not for others, like going to the pub, going to the shops, and certainly not for work.
Thank you very much, John. And Tallulah, what's your opinion?
Thanks. Firstly, that I agree with what's been said so far, but I want to contextualize it from a public health perspective in terms of infectious disease control, and to contextualize the discussion of vaccine certificates and vaccinations within that context. So, you know, what are we trying to achieve? We're essentially trying to reduce the risk of infection, the risk of transmission, the risk of exposure. We know that those are premised on three factors. So characteristics of the host, so human beings themselves, the agent, so the virus, and the environment. And that's the triangle when we're thinking about infection control, we're thinking about all the time. And I say that because it's important to contextualize the vaccinations within that. So vaccinations are a key part of the host aspect, because having hosts that are immune, that have demonstrated protection against severe disease and reduced risk of transmission is a critical role that vaccinations play. But also important to contextualize the context of the environment, right? So the exposure and the risk of exposure, as well as the characteristics of the virus as well, in terms of how it mutates and the different variants and how that impacts on the immunity of the host, as well as the environment in terms of transmissibility. And I say that because then when we talk about certification, the first question we're asking is, where do vaccinations sit within that? And we know that vaccinations play a really critical role and are key in our armory, but not a silver bullet. So we need to be then thinking about, well, how does that complement strategies to reduce exposure risk and make spaces safer? What strategies can we put in place to reduce the risk of the agent mutating in ways that could evade the progress that we've made with the vaccine? And then we ask secondarily, what contribution does the vaccination certificate make towards that? And the challenge is, at the moment where things stand, is that from a scientific perspective, there are a lot of uncertainties around there's a wide variation in the effectiveness of different types of vaccines, the durability of immunity, the emergence of variants, and the variability in effectiveness against those is unknown. And even when we're talking about the domestic use, I think it is important to contextualize. My colleagues have talked about international versus domestic, but we also have to contextualize the fact that when we're talking about domestic use, we're not just talking about vaccinations received in this country by residents of this country. So the day-to-day, this is a hub. So you have people who would be vaccinated elsewhere with different vaccines, with different certifications. So actually, also when we're talking about domestic use, it's important to recognize that we would have to those challenges would need to be navigated. So ultimately, thinking about the primary goal of reducing infections, reducing transmissions, and reducing morbidity and mortality, it's really important to contextualize it within that.
So it's what I'm just trying to sort of summarize here. So if the argument is that vaccine passports help the public health response to this virus, or at least mitigate some of the risks against opening up with the public health response, what I'm hearing from you is the jury's kind of still out on that, or are you even more skeptical than that and saying, well, actually, it's still quite risky and we shouldn't do it? What's your sort of opinion about where we are on that scale of actually this is a great idea and we should do it and the government's absolutely got it right, or actually we really shouldn't be because it's not the right approach? What's your view, if I could try and pin you to somewhere on that spectrum?
Sure. So I think the timing is really critical. So if we're talking about, because I think my position will evolve with time. So if we're talking about where we are at the moment, and where we are at the moment is that we are still rolling out and doing a really good job at that. We're still rolling out vaccinations across eligible adults. We still have significant pockets of populations where uptake is not as high as it could be and it would need to be. We're still at a point where we're not, despite the fact that we're going into summer and we could be pushing things outside, we're not doing well enough at thinking about the standards and support for the standards that we need to place around ventilation, because we know the primary route of transmission is aerosol, strong evidence towards that. So where we are at the moment, my position would be that given where we are at the moment, the strategy, the most effective strategy at the moment would be optimizing those controls that we know would be effective. So supporting the community efforts and thinking creatively about how we can address the vaccine inequity within the country, thinking about strategies to make public spaces safer, so increase confidence and pushing activities outdoors even as we go to summer. And then a few months down the line, if we're at the point where we're saying everybody's vaccinated who can be, where we're saying we're doing all we can to keep indoor spaces safe by putting in these ventilation, we're doing all we can to support global access to reduce the risk of emergence of agents. So I'm going back to the triangle of the agents, the environment, and the host. Then we're in a better position to say, okay, what are the critical issues that we need to address in certification to make sure that supports being able to show evidence of vaccination, because we do want everyone to get vaccinated who can be.
Thank you. Baroness Brady.
Thank you, Chair. Morning, everyone. I just really want to understand if I've understood you correctly, Stephen. Are you saying that vaccine passports become irrelevant for domestic use if the vaccine uptake is high or infection is low? And Tallulah, to your point, are you saying that now is not the right time, regardless, for vaccine passports to be introduced? And if you are saying that, and you're saying you want to wait a few months, how long do you think they ought to be introduced for?
Do you want me to start and then go to Tolu?
Yes, please.
Okay, so I mean, logically, if everybody is vaccinated, you don't need a vaccine passport because you know that people are vaccinated. You need vaccine passports only when there is limited uptake. And if the suggestion of a vaccine passport for basic activities reduces the proportion of people who are willing to get vaccinated, then it becomes counterproductive. Now, the evidence I was talking of, and as I say, this is data being analysed at the moment, so it clearly needs to go through peer review and so on, but it's telling us that when you ask overall, will vaccine passports affect your willingness to take the vaccine, it doesn't have a negative effect. However, that's the entire population, including people who've definitely made their mind up. The population that matters are those who are hesitating, those who don't say definitely yes, and those who don't say definitely no. And if you look at those, the ones that we need to persuade to get vaccinated, then actually the suggestion of a vaccine passport for these everyday activities, like going to the pub and so on, reduce willingness to uptake, and they reduce that willingness more in more marginal communities or communities which are have a worse historical relationship with government and with the state, Black populations and so on. So it does look, from the evidence that we have, that the critical populations who you want to get on board, you're actually pushing away in this sense, and therefore you're undermining our key strategy, which is to get people vaccinated. And remember also, if you don't have people vaccinated, the problem isn't simply in pubs, it's everywhere. And therefore you're creating greater problems in society as a whole. So, and in many ways, I would echo what Dr. Oni has been saying, which is right now, I think the key strategies we need is to get everybody vaccinated and to make public spaces safe. And vaccine passports generate heat, controversy, division, at a time when we need clarity, we need unity, and we need everybody to be, in a sense, singing from the same hymn sheet. So I think in some ways they're counterproductive. In some ways they're a distraction. They're not helping us move forward at this point in time.
Thank you. Dr.
And thanks for that question. And your question speaks to the exact challenge. I think if there's one thing we've learned in this pandemic, it's how quickly science and knowledge evolves, and the importance of evolving with it and recognizing what we know now and what will emerge. So the questions you have about how long the certifications would last for, I don't know, because we don't have information yet on how long immunity will last with vaccination, whether that varies with different vaccines. We don't know whether that varies with different predominant variants. So but that information will emerge in the coming months, because we will be getting to a point where we will have vaccinated. We've had for a longer period than we're followed up doing the trials. So as that emerges, we will get a clearer picture of whether a vaccination certification would be something that would be feasible in the context of how long immunity lasts for, how specific they would need to be to different vaccines, and in different where different circulating variants are predominant. So all of those details we don't have at the moment. So my short answer is I don't know, and that's part of the challenge. And whilst on the other hand we have some clarity of interventions that we know are effective and we know we could be doing more of. So in the context of prioritizing, that's the reason why I don't think that this would be a priority for the moment.
Thank you very much.
Thank you very much. Caroline Lucas.
Thank you, Chair. I wanted to come back to Lula, if I could start with you. Some people would say that vaccine passports would protect us from future lockdowns. I wonder what your response is to that, and in particular, how the passports, if they were to be introduced, should fit alongside other suppression policies.
Thanks. That's I mean, the lockdowns, we all tired of them, aren't we? And that's really not the intention. But but we, again, going back to the first principles, what we're aiming to do is reduce infections, reduce transmissions, reduce ill health, and reduce death. Right. So if we work through that, we're in a pandemic, so I'm afraid we can't talk about local without talking about global, because unless we assign ourselves to being cut off from the world, which we cannot do. So the first thing, this is how I would think through it. So at the global level, because it's a pandemic, we have the current vaccination access both being inequitable and inefficient, and we could do a lot more in this regard. Because we can't cut ourselves off, we have to accelerate the efforts to address vaccine access globally. So that's the first thing. Locally, I think vaccines do play a critical role in controlling this pandemic, but as I referred to earlier, it just really can't be considered a silver bullet, because it's part of the toolkit to reducing infection risk. What else is in the toolkit? Well, if we're resuming activities over summer, how do we reduce exposure? We can increase ventilation, particularly indoors. We can put in place standards for ventilation, because that's where the risk is greatest. As we continue, we are likely to have local outbreaks, and depending on the emergence of new variants, which may or may not be more infectious, or may not be more transmissible, which may or may not evade immunity, we would need a really strong system of being able to quickly identify cases, to trace who they've been exposed to isolate with support to the cases and contacts. That will be really critical in avoiding avoiding a lockdown, because the reality is, as long as there is a pandemic, there will be infections going on. And as long as we're not cut off from the world, we will get new cases going through. So the critical thing is, how do we vaccines keep a greater proportion of our population immune, and we can really augment that by ensuring that we prevent transmission by having a strong tracing and an isolation system in place.
Thank you. Could I just see if Stephen or John had anything to add to that?
Well, the first point is there is a danger of being terribly parochial in the way in which we look at the pandemic. And let's not forget that last week was the 9th straight week in which global cases have gone up. It was the worst week in the history of the pandemic. Nearly 6 million people were infected. And there were as many infections last week as there were in the first 5 months of the pandemic. So we are far from out of things. And as Tolu says, this is something that goes around and comes around. I mean, we were a little bit complacent, back a year ago when we saw it in China. Well, that was a long way away. And we saw in Italy, well, that was still abroad. And then it came here, and it can again come here. So we can't be complacent. And the other thing is, let's not forget that 2 months ago, the Prime Minister of India was saying, well, it's all over. We've got on top of the pandemic. And if you are complacent, it can come back and bite you very badly. So I think the first point to be made is, yes, things are going well here, and we should be delighted at that, but we shouldn't make the mistakes that people have made elsewhere, including in countries where there has been high levels of vaccination, such as in Chile. So we've got to deal with the global pandemic. And if there's one thing that we could do in terms of the global pandemic, it is to waive patent rights, because there is capacity around the world to manufacture vaccines, but people can't because they're not allowed to. So it's not simply a matter of redistributing the vaccine. We can't produce enough, but that's ridiculous then to leave those factories lying empty. In Bangladesh, for instance, there is capacity, they've got a good vaccine capacity to produce enough vaccine for probably 2.5 times their population, but they're not being allowed to do. So I think, in many ways, that's a vast scandal, because millions of people are going to die for lack of the vaccine. And talking domestically, well, vaccine passports aren't going to stop the possibility of a new lockdown. Vaccination is. So I come back to the point that if vaccine passports get in the way of vaccination, they don't reduce, they increase the probability of a new lockdown. But on top of that, again, it's critical to make the point that vaccines on their own are not the whole story. They're a magnificent part of that story. We wouldn't be able to do what we might do without them. However, number one, let's not forget that still it's only a quarter of the population who've had 2 vaccinations. Let's not forget the fact that there can still be circulation of the virus that can do a lot of harm and generate new variants that can undermine the vaccine. So we need to suppress infections. And I think, again, there is a number of very simple things we should be doing. We should be making sure that all spaces are safe and people know they are safe. If you go to the state of Pennsylvania in the US, they have a self-certification scheme. It's all online, you can see it, whereby every business can self-certify as meeting COVID standards, and anybody can then go on the internet and look at what bars and restaurants and so on around them have got proper ventilation, have got proper safeguards, and so on. That increases confidence, it increases safety, it increases footfall. We should be thinking about how can we ensure that spaces are safe? How can we give grants to businesses and in fact to homes for ventilation in the same way that we used to give insulation grants? How can we help people to keep themselves safe? So safe spaces. And then on top of that, as we open up more and people can circulate more, it becomes ever more critical that if people are infected, then they've got to self-isolate. And people still are not self-isolating because they practically can't do it. We can see positive schemes which give people those support and are very effective. You can see it in New York, but you don't need to go to New York. You can go to Newham in London And you can see those schemes working there, that if you give people the support they need to do the right thing, they will do the right thing. And for the life of me, I cannot understand why we are spending £37 billion on test and trace and not spending the money necessary to do the simple first thing of public health, that if people are infected, remove them from the train of transmission. Lots of things we can do to bring the infections down, to keep us safe, and to make sure that we don't have to go back into restrictions and into lockdown.
Really powerful. Thank you very much for that. Chair, I know you want us to move on, so unless there was something, John, sorry, I feel that I've left you out.
Well, just briefly to add to that, I mean, there's evidence from repeated surveys with very big samples showing that the one area of mitigation that's failing is find, test, trace, isolate and support. And it is financial reasons. These are the reasons. It's the poorest people that are going out to work, going out of their homes when they're expected to self-isolate. That is the big gap. That needs to be fixed if something's going to be fixed or changed.
Thank you.
Can I just add to that an important remark, because when we talk about that support, sometimes we forget with vaccination access, right, and access to vaccines in this country, because it's free, we sometimes neglect the less obvious financial barriers to getting access. So whether or not you have a vaccination center close to you that you can get to, whether or not you can take a day off work to be vaccinated without having to take a day's leave. So there are these invisible barriers. I think it's important particularly in certain areas where there's greater proportion of deprivation, that we don't dismiss people as being vaccination hesitant or skeptical, but ensure that we are actually addressing all the visible and invisible barriers to getting a vaccination.
Thank you very much.
Thank you.
I need to point out that we have theoretically 12 minutes left and still 5 sets of questions to get through, which I don't think is going to happen. So I'm proposing that we do stretch it ever so slightly, but I'm begging panelists and also questioners to keep it very tight. And a lot of the stuff that's been mentioned is things we've explored in other sessions. So please keep it very centered on the vaccine passport issue. And we will, of course, take all recommendations in the round with all evidence we've heard over the last, nearly year now. So if I can now go to Lord Strasburger.
Thank you, Chair, and good morning, panel. We've already discussed the psychological implications of the use of vaccine passports, but could they also generate a false sense of security for individuals entering risky premises? And are there implications, long-term societal implications, from turning our society into a checkpoint society for everyday activities? I think I'll go to John first, if I may.
Thanks very much. Well, vaccines themselves and passports can both create a sense of false reassurance if the communication or information around them isn't there. We've already got some evidence of that. I mean, in this rapid review I mentioned at the beginning, there's a couple of studies. One of them looked at testing and found that it's only a minority, but a minority of people receiving a negative test result then go on to increase interactions with others, which they're not supposed to be doing after the test result. And we saw after the first tranche of vaccinations in the UK, that many people, it was a survey carried out, 40% of people over 80 were going out ignoring some of the restrictions. And we saw in Israel, there was a sudden spike in infections that was hypothesized to be caused by people feeling kind of falsely reassured. I mean, part of the issue is communication. I mean, I've had very variable reports from those people who've had their vaccination on whether they're getting any guidance on how they should behave after the vaccination. The British Psychological Society produced some fantastic guidance. I mean, some people do get the little booklet. If you look in the back of the little booklet, it says, carry on wearing a mask, carry on distancing and so on. Some people don't get that booklet. And we're only just getting the evidence now, when there was the ONS data just a week ago or so, showing that vaccination does likely reduce transmission to some degree. We're only just getting that evidence. So it's still really important to communicate what vaccination means, that it only works after 2 weeks and so on. I don't think there's enough communication about that, given the celebration around the vaccination program itself. As to whether we turn into a checkpoint society, I can't really comment, except kind of speculatively, that I guess to the extent that passports are seen as a way of monitoring, that it does create the impression that we are not trusted, and that could be damaging for long-term relations. But I haven't got any evidence on that, so that's just a bit speculative.
Thank you, John. Stephen, would you like to chip in?
So, number one, completely agree with John that if the rollout of information had been as good as the rollout of the vaccine, we wouldn't have had the bumps along the road, and we wouldn't have some of the problems we have now. So, for instance, all the controversy about AstraZeneca and about the side effects would not have happened if, as advised, we'd had great clarity at the start, telling people inevitably there are going to be side effects and adverse effects. The point is that they are far outweighed by the benefits. So as I say, it shows us that the behavioral science and the communication must always be integrated with, if you like, the life science and the medicine. The two go really well. And when the two have gone well together, then our response has gone well together. On the question of a checkpoint society, again, I could speculate, but I have no more expertise than anyone else. The important thing, however, I think, lies in the realm of perceptions. People are prepared to put up with exceptional rules and regulations in a state of exception, and the pandemic is a state of exception. If, however, they think that those exceptional rules are intended to roll over beyond the state of exception into our everyday world, then not only will it be unhelpful, it will undermine the extent to which they're willing to adhere with those restrictions within the pandemic. So I think that's another reason why it's so important to make clear that this is not about compulsion. It's not about undermining civil liberties. It is absolutely about people's public health. And it is another basis for being worried about so-called COVID passports.
Thank you. And Tallulah, do you want to say anything?
I just want to look ahead to the future as well, because one of the things we have learned from this pandemic is the importance of trust in society before a health emergency. So if we're talking about an intervention that could potentially alienate and aggravate levels of mistrust, we need to be thinking about that, not just in terms of this pandemic, but what is to come. This is an exceptional situation, but it's by no means the last health emergency we will face. And so the work to building that community trust for future starts now. And this is what we're doing. So what we're doing is building trust for this pandemic, but also for future health emergencies. And so we need to be very careful about compromising trust that is only slowly and being painstakingly built during this pandemic.
Thank you. That's a very good point. Back to you, Chair.
Thank you very much. Philippa Whitford.
Thanks very much, Chair. If I could go to Stephen and then John and Tallulah can add if they've something additional. Stephen, you suggested vaccine passports comes close to making vaccination mandatory, which the UK has always avoided. And just picking up Tallulah's point about the impact that could have on vaccination uptake in the future. So do you feel that vaccine passports shouldn't be introduced domestically to avoid alienating the groups you mentioned might have lower uptake? And are you anxious about the discrimination or exclusion of younger adults who in actual fact will not be fully vaccinated until September or October?
As I say, for me, it's very much a matter of perceptions. I speak as a psychologist, and it is the perception that something is compulsory which will render it counterproductive. And that's why this isn't an issue of philosophy, and it's not an issue of ethics. It's an issue of empirically looking at the communities we need to get vaccinated and asking what the impact will be. And the empirical evidence does suggest that those communities with a history of lack of trust in our institutions are more likely to see vaccines as compulsory. As you may know, there was a report, I think it was in 2020, from a joint committee of the Lords and Commons on racism, which showed I mean, a deeply depressing statistic that 60% of Black people in Britain consider that the NHS pays less attention to their health than that of white people. We have a historical experience of being treated differently and a historical mistrust. And we've got to acknowledge that in asking what the impact of these measures will be. And the evidence does indeed seem to suggest that those communities that we need to draw in, and those communities who we need to persuade that this is being done with them and for them, begin to perceive this as being done to them and imposed upon them. And that then makes things counterproductive, and it makes things counterproductive moving forward. Because one of the great dangers, as many people have pointed out recently, the Runnymede Trust and others, is there's a real danger that this pandemic will become a pandemic of inequalities, with certain pockets of marginal communities, of deprived communities, in which people are more exposed and in which people are less vaccinated. And in fact, it's not an issue of, for instance, age or ethnicity. The two intersect. So if you look at the figures for levels of vaccination, it's much higher for white groups than Black groups at all age groups. But the differential amongst over 80s is about 20%. The differential for 50 to 54s, which is the last group for which we have full data, is about 30%. So we've got to be very careful not to exacerbate that and not to increase issues of inequalities through measures which exacerbate distrust. And I just want to make one final point. In Israel, a lot of people talk about the Green Pass, and they talk about the impact of the Green Pass. Looking at the data, actually, when people were asked, the Green Pass didn't have much effect on willingness to have vaccine uptake. The thing that did work were community engagement programs, like going to communities, taking vans to people, picking up to Lula's point about the practicality, taking in experts who could go into people's houses, explain things to them, deal with their concerns. So absolutely, community engagement becomes more and more critical to deal with the pandemic, to make sure we don't have these pockets of deprivation. And yet again, I come back to the point that my concern with vaccine passports is precisely at the moment where we desperately need that engagement, it can foster a greater degree of alienation, and that's not going to help anybody.
Particularly, as you say, we're trying to win the hesitant to get vaccinated rather than to drive them away. We're very short of time. I don't know whether John or Tallulah have a short comment they want to add to what Stephen has said.
Just briefly, the evidence on uptake and relates to whether passport serve as an incentive or disincentive for vaccination. It does depend. The surveys show it depends on the type of activity allowed. So if it's for international travel and care homes, that is going to motivate people. But as Steve says, it does interact with population. I mean, there was a report from Denmark yesterday. Denmark is the country most ahead in terms of this kind of system. And there's a quote from somebody suspicious. So the people that are already suspicious, the people that you want to persuade, and the quote is, what they're doing right now is forcing you to take a vaccine. That is how it was perceived. And as Steve says, that's what matters, how it's perceived.
So can I just interject, just to make sure I'm absolutely clear about this? One of the arguments for the vaccine passports, possibly the strongest, is that it incentivizes people to take the vaccine. What I'm hearing from your evidence is that we risk the opposite happening.
That's never been the strongest argument. I mean, that's been one possible benefit, a side effect. The rationale has always been in terms of making more space, more places available for more people. It was thought of as a possible benefit of the Green Pass scheme in Israel, but as Steve says, there were other. It's not even properly being imposed over there. So it is one possible benefit, but it hasn't been the main rationale.
Okay.
Is it not more that it's, instead of waiting till September, October, when, as Stephen says, we expect the vast majority of people to be vaccinated and wouldn't need a passport, it's to try to accelerate the economic opening without waiting for that?
But can I just respond to Layla's point? There is a very traditional, well-known psychological process called reactance, that if you take away people's autonomy, if you force them to do something, they will reassert their autonomy, even if that means not doing things that they would otherwise want to do. And anybody who is a parent knows that. You say to your child, you must go to bed, and even though they're desperate to go to bed and their eyelids are drooping, no, they're going to stay up to assert their autonomy. Well, that's true not just of children, it's true of all of us. And therefore, that's why it can undermine an activity you might otherwise do. And that's why making something compulsory, or at least doing something which leads to the perception of compulsion, can actually undermine activities which otherwise people would do and might even want to do. So the answer to your question, Layla, is it's debatable how central the criterion was, but I think it certainly is true that when it comes to incentivization, then vaccine passports, precisely for those groups who are hesitant, right, for the groups you're trying to persuade, probably are counterproductive, and the evidence that I'm seeing at the moment suggests that they are, particularly, as I say, particularly for those marginal groups like the Black population in the UK.
Fantastic, thank you so much. Barbara Keeley.
Sorry, Tallulah was just trying to add a
Oh,
comment.
sorry, yeah, we are already over time, everybody. So Tallulah, if it's vital, go for it, but otherwise we need to move on.
It's a point that hasn't been raised because we've talked about unintended consequences and alienating based on people's experiences, particularly around age and race of, say, experiences of the NHS. I just want to add an additional unintended consequences around perception of also and experiences of how these kinds of things are also enforced. Right. So even in the context of the legislations around something that seems fairly innocuous, we know from people's experiences that they're not equally enforced. Right. So you have differences in experiences by age and race as well. So that's another potential area for divisiveness, not just in having to have the passport, but actually how access is enforced. So I just wanted to highlight that source.
Thank you, really appreciate it. Barbara Keeley.
Thank you, Chair. Well, just a further clarification, really. Professor Vraki, you've talked about the impacts of vaccine passports on hesitant groups if they're introduced for everyday activities, and Layla's just clarified that. But can we just get to the point? Is there a different reaction then for different uses? Because I think you talked about earlier on that there's an acceptance if it's for international travel, but not for everyday activities. So is that true of hesitant groups as well as across the population? And an extra point, will COVID certification that includes prior COVID-19 infections actually encourage to any extent deliberate exposure to the virus so that people, can get their vaccine passport based on the fact that they've had it?
Well, the answer to those two questions, because we're limited for time, is number one, yes, and number two, I don't know.
Yeah, okay.
Number two, yeah, there is evidence from the surveys. 5 out of 6 surveys that looked at that question found that a minority of people said they might self-infect in order to get a passport, and that was more likely amongst younger groups and people in MOOC jobs. However, that is self-report data of hypothetical questions. Whether it actually occur in real life, I don't know, but that's in the review I shared earlier.
Yeah, Tallulah, anything to add? No, okay, thanks.
Thank you so much. And Simon Russell, Lord Russell.
Just very quickly, on the basis of what we've heard, if you had to synthesize that into 1 or 2 sentences, which is if the government asked you what you thought should actually happen now with vaccine passports, what would you say? Stephen first.
I'd say right now, I would say concentrate on increasing levels of engagement and vaccination in those communities where it's relatively low, and concentrate on making spaces safe and giving people the information about which spaces are safe.
Thank you. John?
Yes, if society is happy to go ahead with the impacts, known expected impacts on inequalities, because I can't see how those inequalities can be fixed within a passporting scheme.
Thank you. Tallulah?
Yes, I think very similar to Steve. I think supporting local communities with increasing vaccination, and that includes enhancing access, confidence, and convenience, particularly when people are underserved. Support with enhancing tracing and supported isolation, encouraging activities outdoors, especially as we're moving into summer, making riskier indoor spaces safer with standards, and supporting those businesses with increasing ventilation or air cleaning. And I think those would be the priorities. And then given the broader global context as well, supporting a global, improving the global vaccine in equity.
Thank you.
Well, thank you very much, panel. We pulled it back at the end and we're only 6 minutes over, and I'm incredibly grateful to everyone who's asked questions, and of course to the panel for answering questions. So to Lula and John and Stephen, you are always very welcome to stay for part 2, where we're going to be talking to industry reps, but equally you're very busy people. So if you'd like to step off, we shan't be upset by that. Thank you so much for your incredibly insightful, as ever, contributions. They've been incredibly helpful. Thank you, thank you, thank you. So I now move to the second half of our panel today. I'm just going to find my papers, here they go. So it's with great pleasure that I introduce Bill Bush. Welcome, Bill. Bill is the Executive Director of the Premier League, former Senior Advisor to the Prime Minister and to the Department of Culture, Media and Sport. Thank you so much for being with us, really appreciate it. We also have Henk van Claveren, Head of Public Affairs at the Airport Operators Association, the AOA. The AOA is the trade association for UK airports and is the principal body engaging with the UK government and regulatory authorities on airport matters. So welcome to you too. And finally, we have Paul Newkey, who's the Global Health Security Editor at The Telegraph, a senior British journalist who has extensively covered the coronavirus pandemic, including the use of COVID passports in the travel industry. So welcome all of you. And I'll start with a general question to all. In your opinion, is it safe for mass gatherings and international travel to commence this summer? And if so, how important are vaccine passports in getting a return to travel or mass gatherings? And perhaps, Bill, could we start with you?
Oh, I was hoping to come third, but I'm quite happy to kick off. Premier League is what it is. We're a football competition. We have 380 matches a season. We have 2 match rounds at the end of this season, at the end of May, where we've been given permission to have some fans back, but at restricted capacity, which is a maximum of 25% or 10,000, whichever is the lower. And actually, because of the nature of stadia, some are much better ventilated, for example, than others, got much better transport facilities and so on. The actual capacity will be, under the restrictions, will be down at about 17, 18% or so, at which point a number of clubs will be losing money on staging the event. So it will be done for football and connecting with the fan reasons rather than as a commercial enterprise. Our season starts again in August, when obviously substantial larger proportion of the population will be vaccinated, and obviously we all hope that prevalence numbers will fall, partly perhaps because ventilation is so much easier in the summer, but we would hope as a winter sport for longer term reasons too. Our approach to this is an ideal outcome would be for full reopening to take place, because prevalence is so low that it's unnecessary to go any further in terms of either social distancing or lockdowns or combination of the two. We do support some form of certification for for our events, and I can speak as well for other major sporting events and major commercial entertainment industries, because we've been discussing this matter with them extensively over the last few months. We do think the system ought to be a universal one, that vaccination alone would not be sufficient because of its divisive nature, and anyway, vaccines are not fully effective in themselves, and there are problems with young people and so on, and those who can't be vaccinated for medical reasons. And the universal system, which is being used to some extent in travel and at schools, is testing. And we're well aware, of course, that lateral flow testing, self-administered, is not that effective. It has some positive impact, but not to a high standard. And so our approach would be, all we want to know for the large numbers of people who would attend football matches is that the prevalence is low and those attending can feel reasonably safe from the people that they will mingle with, that they themselves have been tested or vaccinated and therefore pose a low risk, and not merely to the people in the stadium or at the event, but in travel to and from, in the high streets and so on, getting refreshment as they approach the ground and leave it. If we cannot increase the capacities beyond the 17% that I mentioned earlier, then the economics of the commercial entertainment industries are completely destroyed. And we are substantial employers. Premier League alone employs about 100,000, often in relatively low income jobs in hospitality and security stewarding and so on. And we are an important part of the earnings of the demographics who serve our events. We are, if you like, the ultimate original gig economy from the 19th century onwards. Clubs play once every 10 days or so in season. We don't provide continuous employment to a high proportion of our employees. And so we're faced with social distancing, with all the restrictions of personal freedom and the restrictions on economics and employment and so on, go with social distancing. Lockdown, which is disastrous for commercial entertainment. You can see that the suffering they've had and the losses they've made, and without furlough, huge unemployment would have followed. Or we have low prevalence, which may be a very long-term objective, given what we just heard about problems around the world. Or we go to some sort of managed living with coronavirus circumstance, in which we believe provided testing can be delivered for a wide range of the population, provided they know this is purely voluntary. If they wish to go to the event, it's a way of increasing the capacity so more fans can attend. But testing is burdensome. It's also expensive. It has to be paid for by the event attender. And so vaccination confirmation, provided it's provided voluntarily, can be a substitute for requiring testing evidence. This enables those who want or need or who prefer testing, rather than to disclose their vaccination status, know that there is a system that they can use. But for a major sporting event, let's say 50,000 turn up, if all 50,000 have to be tested, then really the infrastructure is only there for self-administered testing. And so it makes sense, logical, practical sense, for everyone to be required to test, except those who can demonstrate vaccination. And obviously it's easier for us to say that, because the main point at which that comes necessary to us would be August the 14th, when our season starts, when vaccination will have much greater penetration. And we do understand that the summer sports, looking at the challenges of this summer with a partially vaccinated population, don't have our time frame to be worried about.
Thank you. Bill, can I just ask a quick follow-up? So you said the cost of testing is borne by the event rather than the state. I didn't realise that was the case. Did I understand that correctly?
Sorry, it could of course be borne by the state. I think though, in the long term, if testing is to continue, then either the state needs to say living with coronavirus means having a substantial capacity. Therefore, we, the state, will invest in it for the long term. That clearly would.
What's the situation right now?
Well,
as you understand,
very few fans are attending, and when they do attend later this month, I'll come back to the events research program in a moment. But for the generality of sports, it's only 2 match rounds from the 18th of May until the 23rd of May. 2 match rounds where attendance will be allowed, and that will be with full social distancing, without testing or any other certification. The events research program, which is underway now, is a very carefully controlled and managed set of exceptions to that rule. And you may have seen on television the Crucible Theatre in Sheffield had the final, I think 900 people, full capacity, no social distancing, but they had 3 tests. Attendance involved 3 tests. And you can see how that is both a time burden to get that done, but the financial burden has to fall somewhere, either on the individual or on the state.
Have you been told when you'd expect the results of that?
It will be late in May, too late for us, if you like, but in time for the summer sports, football included, because there's a major international, the Euros take place with a number of matches here in England and in Scotland.
Thank you very much. Henk?
So the Airport Operators Association, we represent the UK airports, and I think that from our perspective, international travel this summer should be done on a risk-based proportional approach. I think we support the idea of a traffic light system as the government has set out. I think that we have some concerns around the barriers still in place on the green travel for the affordability and the ability of people to make use of that. But we do think that low-risk countries with low prevalence and high vaccination programs underway should be possible to travel to over the summer. I think there are really important economic and social reasons for the restart of aviation. About 1.6 million jobs rely on aviation and tourism in the UK. But more broadly, a range of companies out benefit from aviation for visiting, their clients, opening up new markets, particularly in a lot of other places. The personal touch remains a very important one. And if we want it to be that kind of outward-looking Britain, then we do need aviation and international travel to restart. I think a lot of focus in the media has been around holidays, but actually about a quarter of travel in 2019 was for visiting friends and relatives. And there are millions of people out there in the UK at the moment who have relatives abroad. They may be close relatives, grandparents, grandchildren, parents, siblings that people haven't seen for at least 12 months. The travel corridors last year were helpful, but were only to a limited number of countries, and people may not have the opportunity to see really close relatives. We want to be able to facilitate the holidays, we want to be able to facilitate the business travel, and we want to be able to facilitate the visiting friends and relatives.
And on the vaccine passports point specifically, what's your sense of the timeline, when they're going to be introduced, and how are airports adapting to take into account the international vaccine passports specifically? Yeah,
you may have seen the European Commission's announcement yesterday, and they are proposing that travel could be possible for vaccine, and there would be different regimes in place for those who are vaccinated and for those who are not vaccinated. In other words, internationally, vaccine passports are an inevitability. Countries will require them in one way or another. Some may not, but a large number will for people arriving into the country. So whether we have a view on whether they are the right thing or not for travel is actually, we just need to adapt to the reality that they are happening. The timelines in the UK are we heard the announcement last week that the NHS app would be used in England. I think we have a number of points around that we need to ensure that there's a four-nation approach, not just an England-only approach. I think the Welsh First Minister was very strong on his view that it should be a four-nation approach. And over the weekend, Scottish organisations have also come out for that four-nation approach to restarting travel and using a single portal or app for enabling people to prove their vaccination status. But it's not just about vaccination status. We've seen that people will require also proof of testing, even if they are vaccinated. Again, that depends on the different entry requirements of the different countries, but some require both.
Yeah, and Henk, if you probably know more about the detail of it than we do. Is it lateral flow testing, or is it PCR testing, or either or both that you are aware of is the type of testing that will be accepted?
That depends on the country. So different countries have different requirements. Some require PCR tests, some require two tests. So for example, a PCR and then a confirmatory lateral flow test before travel. The Netherlands is such an example, although they are relaxing that rule currently that we apply to the UK. But in case because of our low prevalence, they are being more relaxed about those rules. There are other countries that are saying actually lateral flow is also fine, and then potentially a test upon arrival, similar to the UK system. But it really varies from country to country. the NHS app, if it does indeed is used for that process of vaccination proof, does need to include test results. Currently, as we understand, the proposal does not, but there are a number of industry apps out there, IATA's Travel Pass, the World Economic Forum's Common Pass. There are a number of solutions out there that combine both vaccine proof and test certificate proof, or COVID-19 proof. The European Commission's Digital Green Certificate will certainly include all three of those. If the UK government sort of app is to be a useful tool, it needs to include similar measures. If not, it needs to be able to allow these other apps to pull out the vaccine data to be able to be integrated in the industry solution. In terms of how it works for the travel, it depends. So the vaccine certificate will probably be useful in a digital format at boarding in the UK airports. Upon return, the Border Force in the UK and the Home Office made very clear that they will not accept these digital solutions. They will require, at the moment, paper-based solutions to prove what you have put into your passenger locator form. They're working very hard to try and digitize the passenger locator form to ensure that you can use it, if, for example, to get through the e-gate upon your return. But that's not currently possible. And indeed, it needs to be possible, and it needs to be possible really rapidly, because the queues at the moment are unacceptable from a passenger welfare perspective, but also from a safety and security perspective. Other countries may or may not accept these digital solutions at the border. Again, that will vary from country to country.
Okay, thank you very much. That was very helpful. Paul, what's your opinion? Is it safe to travel and go to mass events at the moment, do you think?
I think a lot depends on these pilots that they're running at the moment and the results. I think that's going to be absolutely crucial. I think it's very important to note on those pilots that everyone had to show a negative test before entering. So it seems to me extremely unlikely that the pilots will conclude that a negative test or a vaccine certificate is not required. That's the logic of things. And that given, it seems to me that we need a system, as the gentleman before was making clear, that is administratively simple and secure. And when I've traveled recently to Africa and back, it's pretty evident that the system is anything but that. It's chaotic, it's insecure, it makes very little sense, or it made very little sense to me as a consumer. And I think that unless that system is built to provide consumer confidence, that it will unravel very quickly and no one will pay any attention to it. So in many ways, I think that the challenge ahead is a delivery challenge, if you like, an administrative and delivery challenge. You know, can they get these apps built in time? Can they sync them with reliable data in time? And my big worry at the moment is that that doesn't look very likely. And I think that the split between private and government provision of test results, of vaccine results, is likely to make things much more difficult if we proceed with that. At the moment, if you get a test, PCR or lateral flow through the test and trace system, most of that now seems to be digitized. It's held on a central system somewhere. And one can imagine that being pulled up into a central app. But on entering the country, when I came back from Africa, you can choose between whatever provider you fancy from the internet. You sort of wave something at them saying that you've booked an appointment when you come in. But those results are not put into a central system. It would be virtually impossible to see how, within the time period we're talking about, that they could be. So it seems to me that there's some real delivery focus that ministers need to think about.
Thank you very much. Baroness Brady.
Afternoon, everyone. I think both Henk and Bill have both said that they feel vaccine passports are going to happen, but we haven't heard how they're going to happen and in what form they're going to take. And I'm asking if you have any information about that, but also the consequences of data sharing with whatever form that is going to be used, and who's going to manage that, and under which jurisdiction is it going to be managed? Perhaps to Henk first.
So, because it's international travel, it's actually quite a complex question, but I'll try and answer it in as best as I can. At the moment, we're not fully aware of the way that the UK approach will be, but as I understand it, it'll be the NHS app that you can currently use to book your GP appointments. Indeed, I have the app. I can see my first dose of my vaccine on that app. It is registered on the date that I did it. It is about turning that into something that is then usable for travel. So that could be, for example, in the same way that you use a boarding pass, that you check in and it creates a QR code that is that you can then store in your phone's wallet that you can then show to the relevant people. That could be one way of solving that. I think the question about data sharing is a real key one, particularly when it comes to test results, etc. Because you don't want to show your entire medical record, which is on the NHS app. You want to show just your vaccine or your test, and how do you ensure that? Now, within the NHS system, the data sharing is already itself quite a complex matter because of the various parties involved in the vaccination effort. But I think the government is looking at that through Public Health England. What then becomes the next stage is how do you ensure that's a four-nation approach, that the three other health systems are also sharing into the same process, so that as a consumer, you don't need to download different apps depending on whether you're traveling from England or from Scotland, for example, which people do. That then sort of the way that we see some other places going at it. So the European Commission is currently setting out its approach and its regulation that should be on the books by the 26th of June. And currently there's a number of trials ongoing around the digital green certificate. This will also use a form of QR code, most likely on your phone, but they have different shelf life. A vaccine QR code is essentially for a longer period of time because your vaccine is not changing, but for every test you would have to generate a different QR code that can be scanned, for example, by the airline or at the border in the relevant system to check that you have got the right information there. The industry apps are really about voluntary data sharing. I am, as a consumer, downloading the IATA Travel Pass or the Common Pass by or one of the other solutions out there, and I am authorizing for certain data to be shared and input in it. There are a number of trials ongoing with those apps. Those apps tend to mirror the European app in the sense that they include vaccine tests and COVID status in terms of whether you've had it or not. The UK one is currently only the vaccine one, which is, as I said, an issue. So I think that sort of tries to answer your question, but I know I haven't fully done it, but that's because a lot of it is still in development. But the European side of things will be finished by the 26th of June. And it may be possible for non-EU citizens and non-EU residents, third country nationals, to be able to use it to access it and be able to enter into the EU with that app. Again, exactly how that is working out, that is currently in development.
Thank you. Before I go to Bill, and if Paul wants to add anything, just a yes or no, please, Henk. I mean, given the problems that we've seen with the contact tracing app, how confident are you in the ability for this to be developed by the summer?
So on the NHS app itself, as I say, I've already got the app and I've already got my first dose of the vaccine in the app. Turning it into something that is accessible is, in my view, and I'm not a technical expert, should be a relatively simple technical step. Whether they'll be able to integrate the test result of it, I'm not as confident about at the moment, particularly as government hasn't said it will do that.
Well, it won't work if they don't. Okay, Bill, over to you.
Sorry, I've got. Oh, so pardon me. Sorry.
No, sorry. Yeah, obviously, delivery of the system is it all depends on delivery. They are working fairly hard. Our view about data handling is this: that it is perfectly appropriate in the present circumstances for health data to be handled for individuals by the NHS. We don't want to handle any of those data at all. the ideal system for us would be ticketing information is held by our clubs organising their venue and access to their venue. All that ticket system needs from a health point of view is a simple green light, red light. And that green light could be generated by confirmation of vaccine status, confirmation of a negative test within the relevant time period, or confirmation of antibody status. The venue need not know which of those three questions was answered, which turned up with the green light. So the NHS app, as it were, is a matter for government. We want the data to be handled there rather than to be volunteered by individual consumers. But the two systems talk to each other with a very, very simple, possibly QR code-based system, which simply says yes or no. And only with a yes does the club's ticket then be given status, given the authority to allow entry. It's if like it's grayed out until the computer says yes, at which point it becomes an actual functioning ticket. But it's a long way. Where we are now is a long way short of that capacity, that capability.
I agree entirely that has to be the aim. That whatever the venue, whether it's a passport checkpoint or a football stadium entry point, it needs to be a QR code that says yes or no. There's no doubt about that. I also have the NHS app. I would advise everyone to try and download it. It's a complicated process. It takes at least 24 hours verification at the moment. If 60 million people tried to do it at once, I reckon that would extend to a month or two. And even once you've got it all downloaded and you can access your vaccine data, it's certainly not in that format that is going to give a football stadium manager or a club manager a quick yes or no. And having worked a little bit on technology in the past, I know that that's not a simple process. I mean, it's a doable process, but it's not a simple one, particularly when you're dealing with an app like the NHS app, which contains all sorts of information about your previous prescriptions and diseases as well.
Great, thank you very much. We now go to Barbara Keeley.
Thank you, Chair. Well, as a question to Paul Newkey again, you've been among the community of journalists travelling during the pandemic. You've touched, I think, already on your experience of arriving in the UK. You said it was chaotic, insecure, makes little sense to the consumer. Would vaccine passports, in your view, improve that process? And, you know, potentially what else alongside them would stop it being those things?
I think so. I sort of shy away from the term vaccine passport. I think that the term green pass or certificate is better because it encompasses the option of a vaccine or a negative test result. But again, I think the key for me as a consumer, as it were, is, you know, if you have gone to the trouble of becoming vaccinated, or if you've gone to the trouble of proving you've had a test, you really then don't want a 4-hour queue at an airport where the authority is unable to quickly decipher whether what you've done is correct or not. And this is, I think, the point the gentleman was making about a QR code which says quickly to the terminal, to the authority, yes or no. Just in the same way that as you approach an airport, you know, initially with a boarding pass, you know, you scan that boarding pass and it says yes or no, right? The gates open or they don't. And you really want this digital solution, this green pass, to be as efficient as that. And that's a real technical challenge for the government, I think.
And do you see that happening in the time frame that we need it?
I would be really delighted if it did happen. But I mean, the timeframes are very, very short now, right? People are booking flights this weekend in large numbers to travel early June to Europe and beyond. So, you know, maybe, but there's a lot of work to be done in a short period of time. And I think also the, you know, how these systems work with our partners around the world is going to be very, very important. So Europe is developing a system. It's some way down the line now. We've got to make absolutely sure at a minimum our system works with that system and is not a sort of parallel thing or a duplication, because that would undermine confidence, I think.
Thank you very much. Baroness Masham, are you there? No. Back to Barbara Keeley.
Thanks, Chair. Well, from your experience in research, Paul, how does the UK's monitoring system of arrivals compare to other countries? You've mentioned other countries that you've flown in and out of. How does our monitoring system compare to theirs?
Well, so at the moment, when I last travelled, everything was on paper. So you get a test here, the doctor or the organisation sends you a result and you print it out. Very insecure. I mean, you can run it through your computer and put another name on it, if you like. So at the moment, it's just based on trust. Certainly, as far as the UK is concerned, that's the case coming in and out. In the Côte d'Ivoire, where I was in West Africa, they had a more sophisticated system for departing the country. So you got a test there through a central government setup. And rather than giving you a piece of paper, they then texted you or emailed you a QR code that was then scanned at the airport and compared to the name on your passport. So you couldn't board a plane in the Côte d'Ivoire with a simple forgery. And it was also a system that meant that the system flowed much better.
Interesting to hear. Thank you.
Can I come into that from an operational perspective? I think there's two things that we need to differentiate here. I think that the NHS-based approach is really about proving vaccine status abroad. It's for UK citizens to show that in the UK they have had their vaccine, they have potentially, ideally, for travel outbound, that they can upload the test certificates that they've had for the requirements for the destination country. That is separate from how we enter the country at the moment. The UK is not proposing in its Global Travel Task Force, which is England only, I have to hasten to add. Scotland is not currently opening up. There are no differentiators in the GTT report for people who have been vaccinated. Everybody is treated the same. Everybody has to do tests upon arrival in all the tiers, and more tests if you're in the amber tier, and managed hotel quarantine if you're coming from the red tier countries. So there is a kind of, you have to do the test before go, so that you have a kind of, are people clear at that point of the virus? Then you have to test it upon arrival to check that people continue to remain infection free. There is no differentiation there for vaccination at the moment. That could come in at a later stage. There are review points in for that. That's not the status at the moment. In terms of how that then operates at the border, the NHS app would therefore not be needed, because you don't need a vaccine status. What it's really about is, have you done the right test result, and have you filled out what's currently known as your passenger locator form, which sets out where you've been, what you've done, the test result that you have booked in the UK to do. That is all a manual process at the moment. It's 100% manual checks at the border, which is why you see these significant queues. But in addition to the checks at the border, the airline is also required to check it. They get significant fines of up to £2,000 per passenger locator form failure, and then a further £2,000 for if the airline hasn't checked the appropriate test certificates are in place. So there's a kind of double check. There's the airline that can't allow you to board unless you have the right required documents and have filled them out correctly. And then there's the check at the border, which is all manual. We do want this to be digitized, and it has to be digitized to manage the travel. Even at the moment, with percentage points on the normal travel that you would see, it's unable to manage it. We see queues out onto the tarmac in certain airports because the border force is simply not able to cope with the limited resources that they're putting at the border and the lack of e-passport gates. They need to staff every desk, they need to open every e-gate to be able to allow this to happen. But to do that, they need to digitize the passenger locator form and the test results better. They're working on that, but it is a slow process. And they're sort of aiming to have the e-gate upgrade that is necessary to be able to allow this digitization to happen to be completed by the autumn. Now, the autumn is a preposterous deadline. It needs to be before the summer. But that is a real significant challenge given the sort of resource available and the process required to be able to do this. So I think we need to separate those two things out when we're discussing vaccine passports here, because it's important. The NHS Act will not solve the border.
Yeah, thank you, Hank. If I can just interject for 1 second, you said that there was a review date for
as part of the Global Travel Task Force, there are several review days. The first one is on the 28th of June, then there's one on the 31st of July, and then there's one the 1st of October. It's by the 1st of October, where the review is done not so much on the countries that are on the list, but on the measures that are on the that are for each of the tiers in place. But again, I stress this is England only. For Wales, Northern Ireland, and Scotland, there is currently no roadmap on how international travel will restart. And similarly, there is no approach at the moment on a four-nation basis for a vaccine passport, which has to be the case.
Thank you very much. Baroness Finlay.
Thank you. I think I should start where you left off, Hank, and ask you about COVID passports and certification for this international travel inbound, because it isn't just the passport, but it's the other factors. And I wonder what you feel that the airport should be doing now to keep people coming in from low-risk countries separated from those coming in from high-risk countries, and also separating out people who don't have the adequate paperwork from those who do, to avoid the crowding. Because by having everybody in an internal area, as we heard in our first session, you can get cross-pooling of variants, which may or may not actually not respond to the vaccination program that's been in the country anyway, and therefore heighten the risk. And so what should airports or ports and immigration points specifically be doing differently?
So I think there's one thing to bear in mind as a sort of background to this question, which is the government has presumably got the data on for amber countries currently. Well, they're not amber, but they will be amber in future, the kind of 2+8 day test. It'd be very interesting to see how many people actually test positive on day 2 or 8 of the people arriving. I suspect it's a very low number. We haven't heard of anybody, again, not because the government hasn't announced, because the government has announced it, not because the data isn't there, about how many people have tested positive in managed hotel quarantine. Then I would think that the number is very low. And the reason for that is because actually travel is very arduous at the moment. People are really only doing it for essential journeys. And you're finding that it's particularly from red countries, it's only UK nationals and UK residents that can return. So they're very small numbers of people that are traveling because of the significant requirements in place. And those that do have to have a test before they depart. And that is then checked by the airline before they are allowed to board. In terms of what we can do in the border holes, I think there's two elements to this. We will see mixing of passengers for one reason only. A number of red list countries, the majority of them, have a flight ban on it. If you're a UK national wanting to return to the UK, as is your right as a UK citizen, you have to fly somewhere else. You have to fly via a different airport, and you have to fly in with other people from other parts of the world. It's inevitability. So the mixing is already occurring relatively early on. But again, these people have been tested before they travel. The likelihood of them having the virus is therefore significantly lower than they would if they were untested. At the airport, what needs to happen is, airports are working their absolute hardest to try and manage these queues. But if you get to the sheer length of the queues of 6-7 hours, you run out of space. There's very little you can do about it. What needs to happen is that the border force needs to actually put the resources it has at the border to ensure that they can manage the passenger numbers coming in. There are not many people traveling, that it should be an entirely manageable thing to do. That means that all the desks need to be open, which they're currently not, and they need to use the e-passport gates to be able to automate a significant number of these processes. Sorry,
I'm just concerned because people need to be trained. I mean, being an immigration officer isn't being like a supermarket delivery person. There's a lot of training needed. And the laws around immigration are really pretty complex.
They have the staff. They have had a huge Brexit uplift for a start, which then those people have not are by and large still in the border force system. They are choosing not to fully staff the border, and that is because of the exact details you would have to ask border force. But there is a process whereby they reduce the number of border officials at the border from a COVID perspective, despite the fact that airports have put in place the required screens, and screens have been around desks for a long time, because not least because of to protect the staff from perhaps an irate passenger disappointed with the decision that the immigration officer gives them. So the staff is there, the resource has not changed. It's just that the choice is not to fully staff every desk at the moment. So it is entirely possible to do the full staffing if the processes are adapted to allow for that to happen.
Okay, just then looking at passports for mass gatherings, which may be slightly different. And Paul, can I ask you too whether your travel experience bears out what we're hearing from Henk in terms of the passport and the requirement to link the data of vaccine and testing to the passport, and where the delays are?
Yeah, no, absolutely. My experience, matches that description. When I arrived at Heathrow, having travelled from the Côte d'Ivoire via Brussels, it was just chaotic. You arrived at a huge arrival hall filled with people, really packed, people in close proximity in an unventilated environment for a long period of time. You couldn't hope to tick more COVID boxes. And the bottleneck was exactly as Hank was saying. There were too few people checking people's paperwork. And the paperwork that needed to be presented wasn't a simple digital pass that went ping yes or no. So yeah, I mean, it's problematic from a health point of view and from a consumer confidence point of view. And I think also, I think it's important. Summer coming up is going to be it's coming up fast. But this issue with travel is going to last probably for 3, 4, 5 years. And we need to build a system which is equitable and functional over that period. Otherwise, we're going to really become, one part of a 2 or 3 tier world.
Can I ask Bill then, is anything transferable from this travel to mass gatherings to make things easier and faster?
Well, completely agree that digitization is at the heart of this. The way a football match works, obviously, is people know the kickoff time. They turn up, even if you try and stagger arrivals, you've still got to get quite a large number of people into a fairly limited geographical space and then disperse them afterwards. And so if a very high proportion, doesn't have to be 100%, have some sort of very clear digital system, which, as Paul just said, goes ping and lets you in, then that will disperse the crowd or channel the crowd very quickly. If people are worried about the equity of that with people who don't have smartphones and so on, a small proportion, but it could only be a small proportion, could then be handled probably by prior arrangement, so you don't have people just leaving their phones behind and thinking they'll get through on a paper system. So that some people, a small minority, can be handled in some sort of paper or less than fully digital system. But I described earlier, the system which would work for domestic events, bearing in mind you're not dealing with international problems, which Henk and Paul have mentioned, is one where a simple green with a proper ticket for the event should be able to be combined digitally without much data handling to allow that ping to happen and for the person to move smoothly through into the venue.
Okay.
Can I just interject to say we are already a little bit over time. I'm keen to continue, but I would like to ask panelists if that's okay. We'd aim to wrap up in about 10 minutes or so. And we've got another sort of 4 questions left. So just do the maths, please keep it tight. Back to you, Baroness Finlay.
I just wanted to ask Henk why the border force are responsible for all this paperwork. Why not another group of people? Because this is about test and trace paperwork almost.
This is the UK border regime. It's a responsibility of the UK government to let in who can be let in. It's ultimately a border force decision. There are questions around, you know, first of all, it wouldn't be appropriate for airport staff to do it. We don't have the power to do it. We can't make someone show us something. Plus, if they don't have the required documents, what's an airport staffer supposed to do at that stage? It really has to be a border force role. They need to check that everybody meets the requirements.
Right. Thank you. Thank you, Chair.
Thank you very much. Lord Strasburger.
Good afternoon. Last week, this committee heard evidence about large-scale appearance of fraudulent test certificates and vaccination evidence at the border at British airports, and it was apparent that the staff there didn't have the skills or the information to be able to distinguish a fraudulent document from a genuine one. Does that concern you? Because and before you tell me that a digital solution will solve it, I will say to you that there's a number of very well qualified people who could knock up an app to mimic one of the many apps you've mentioned already today to get around that. So it's a concerning issue. What's your response to that? Shall I start with you, Henk, since it's about airports?
Yes, I think that the skills that Border Force have to spot the right certificates or not, I think is really a matter for Border Force, and I think that there's a role for a government to ensure that they have the resource as well as the training necessary to be able to do this. What I would also say is that we want to have people to have confidence in the system. I do think that some form of digital solution via trust providers will be able to provide that role. Ideally, certain industry-led initiatives do and can integrate into the airline processing systems, and so it reduces the risk potentially of people mimicking, as you say. But ultimately, I think this is a matter for government to decide how they want to ensure that the system that they have put in place is safe. In the same way that a airline staff, if someone tries to get through on a fraudulent passport and the airline staff cannot spot that, they are not penalized for that, because ultimately the border force are the people with the right skills to be able to verify the document and ensure that it is valid. It remains a border responsibility.
Thank you. Paul, what's your experience of this issue?
Well, I mean, I don't doubt that it would be extraordinarily easy to forge something at the moment, and I don't think one could blame Border Force for being unable to spot it. I mean, the system at the moment allows you to have a test from any one of 101 different providers, all on different paperwork, none of them very secure. So the chap at Border Force, or the woman at Border Force, she's got no idea, and the only way that they could possibly double check is to sort of spend a couple of hours trying to phone up whoever has put their signature on it and somehow deciphering whether they're a real person or not. So the answer must be a more streamlined system. You know, it's a small group of approved providers who are simultaneously making their data available on a system that's visible to Border Force. I do think that one area which is very obvious that they can improve, I mean, a lot of the queue that I was standing in was held up because the UK has a requirement that you have organised tests, I think for day 2 and day 8 after your arrival in the UK. And they were trying to establish whether people had booked these tests. Now, if the government required those tests to be done through the NHS system, then I could see that very quickly you could have a QR code that says, yeah, they've got the test booked in the NHS system. But as things stand, where you can get those tests booked anywhere, there's no alternative but to, I mean, I scrolled through my phone and showed them the email from the test provider who said that I would turn up on whenever, you know, but everyone had a different method of proving that they'd booked the test. And that's what I mean. It's a little chaotic and it's obviously not secure.
Well, that's
I would agree with Paul on that. I mean, introducing, there is a question about, you know, the role of the state, as Bill has talked about the cost of testing and whether there's there's a decision to be made about government about where the cost falls. But ultimately, the idea of having the tests in the UK is partly to address your point, Lord Strasburger, around if people have perhaps not had the right test, or they may have been infected after they have done the test, to ensure that you still catch those people. Those tests are there for a reason and are part of that risk-based approach. Now, if government is saying that they're so essential to do that, they may wish to consider whether they take that part in the NHS process. Indeed, from an outbound perspective, actually allowing NHS to test to be for that as well allows you to integrate them significantly easier in the NHS Act, because you don't have to work with third-party providers to try and integrate that data in there. There is a very simple solution to that. The only issue is then that you have 4 NHSs in the UK.
Bill, I'm not sure if we need to trouble you with this one or not. I mean, the concern is with airports that there's people arriving from 100 or more different countries with different standards, which Border Force are trying to understand and decipher. But you don't have that problem in the football industry.
We have it to a much lesser degree. We still have it though. Of course, the majority of attenders in the Premier League are season ticket holders. They have identities which are established with the club, so that helps. But when it comes down to it, proof of identity, whether it's passports or driving licenses or your kind of welfare state information, you know, that your national insurance number and so on, can be used. But the systems can really only work if they're streamlined and there is compliance by the vast majority. But I think the airport scenario versus a domestic venue, the scale of challenges is much smaller once you're into the domestic environment.
Thank you. Back to you, Chair.
Thank you so much, Caroline. Lucas.
Thanks, Chair. I wanted to ask you about employees and whether you think that employees at airports or at mass gatherings or even at seaports should be required to have a vaccine passport or immunity passport. I don't know, Henk, do you want to start with that one?
I think that airports will follow the government guidance on this. I think that if governments decide that that is necessary, then we will work with government around that guidance. Airports are looking after their staff. Many actually have testing facilities on site for the general public as well as for travellers that are also being used by staff. So, you know, we're putting the resources and the systems in place to protect our staff and to ensure that they can do their job properly. If the government then decides that vaccinations play a role in that, we will work with the government to implement that.
You don't have your own view. I mean, some people might say that it would be a key way of keeping staff safe.
It's a similar argument that's played out in the care home sector. There are, this is an argument that goes for a range of sectors, and I think that the government taking a position on this would be the best solution to avoiding us having the debate over which sector and how that does, and each individual sector having its own opinion on it.
Okay. Do Bill or Paul have an alternative view on that?
I would note that New Zealand, I think just yesterday, said that various customs workers had to lose their jobs because they weren't vaccinated. So it has made it mandatory. I'm not sure that I would do that here, but I would certainly say from a health point of view, you would be very ill-advised to be working on the front line in an airport without being vaccinated. And I would major on that message, I think. Mm-hmm.
And presumably the same for seaports as well. We've had stories of cruise ships coming in with.
Yeah, absolutely. I think, anyone who's working, whether it be on a bus or front of house in a pub where you're coming into contact with many people, many strangers, then you've got to think about protecting yourself, because you're more exposed than virtually anyone else, and that's very evident from the death rates, unfortunately.
Would you go as far as making it mandatory, which could mean, I don't know if you were to apply that retrospectively, then that could mean people losing jobs if they didn't want to do that?
I don't think that the history and the culture in the UK lends itself to making things mandatory. I think that's just a peculiarity. I mean, in the States, they do have a history. You have to have your children vaccinated if they're going to go to school in most states. So one has to look at the cultural history of the country, and I just don't think that we're a country that has tended to do that. I think if you look right back, I think that the first smallpox jabs perhaps were, right. But it's a long time ago.
Okay, thank you. Bill, any final thought on that one?
No, we would obviously follow the government guidance on this. In the case, obviously, from employer liability point of view, taking care of the welfare of employees would be to make sure that transmission risk was as low as possible, both to protect them as staff, but also protect in our case, fans in the stadium, in hospitality and so on, where there is close contact. We wouldn't want, I think, to see any one mechanism being isolated as compulsory. So making vaccination compulsory, I think, has all sorts of difficulties which have been well aired, but we could foresee a future, and we would not resist it, if government said that staff had close contact with each other and with members of the public should have a lateral flow test before the commencement of their shift, as it were, to make sure that the prevalence is as low as could be reasonably achieved.
Great, thank you very much.
Thank you very much. And last but certainly not least, Lord Russell.
Yes, thank you very much. So it's been a fascinating 2 sessions, and we've sort of covered some of the ethics and the unintended consequences of perhaps going for a COVID passport. But in particular, in this session, it seems that issues to do with the border force, to do with digitization, and to do with having a more coherent testing regime seem to have jumped out very strongly. So given all of that, I'm going to ask each of you, what would you say to the government in your view, is the absolute priority to help the country, but also to help your sector to get things sorted out? So Bill, can I start with you?
I think the government has a very hard balance to achieve, and there are difficulties whichever route it takes. If it goes for the kind of free-for-all hopes, then there are obvious risks in a world where the pandemic is still raging to go for that. Social distancing and lockdown clearly are economically and socially extremely harmful. And so we would argue that some form of coronavirus status verification, properly managed, both in terms of inclusion, but also the technical operation of the system, could well be a necessary fallback, that if the low prevalence in society as a whole doesn't get us there, we don't have the alternatives of pretty well closing down large chunks of the economy again, with all the social and economic harm that causes. But we would love to work towards, with government working towards a low prevalence solution rather than depend on a single magic wand like a vaccine passport. We think that would be too narrow and too prescriptive. It needs to be broader based than that.
Yeah. Henk, please, if you could be very succinct.
Yeah, we need to restart international travel for economic and social reasons that I alluded to at the start. For the outbound side of things, I think the key will be if we're going to have, and it's some form of vaccine certificate will be required by other countries. So we need to have something in place, and that needs to be on a 4-nation basis, and it needs to integrate test results. Without it, I think it would be very difficult for individuals to achieve what they need to achieve. For the inbound perspective, we need to ensure that we can manage the border appropriately. And that requires a step change in government's approach to the border and really ramping up the preparations for ensuring that we can have the restart of international travel through digitization and integration of various requirements currently into a much more user-friendly and operationally sound solution.
Yeah, okay. And Paul?
Yes, I would say, full steam ahead on creating a digital green pass that wraps in both vaccine and tests. I would do it with a view to it running for 5 years, perhaps even more. And I think if I was advising the government, I would say, having built this enormous and now very successful test and trace system, let's use that as the spine for this thing, because spinning it off to parts of the private sector now is just going to complicate matters. We've built the system. Tests are very cheap, very easy to access. Let's use it. And if we want to include private sector providers, let's include them at the other end of that, so that it's a test and trace system that is building them into the coherent system, and that we're not starting as fresh.
Thank you very much.
Thank you all. We have gone significantly over time, and I beg your forgiveness, but given how important this is, I think, to society, it was right to hear the full answers from everybody. So Bill and Henk and Paul, thank you so much for your time. Thank you as ever to the parliamentarians for their questions. Thanks to all who've been watching from home. Thank you. We will be back in a couple of weeks' time. And I've no doubt that there'll be many issues that have been covered today in very wide-ranging session that we'll come back to. So thank you very much, everybody. Have a good afternoon. Bye-bye.
Thank you.
Thank you very much.